Hi, how are you? I'm Dr. Oscar and I practice aesthetic medicine and anti-aging in Mexico, in Isla Mujeres, Mexico. And at this time, I want to explain you something that I think is very important to know for our patients, and it's how we prepare a Botox bottle. It's important also to understand that Botox is just a brand. The active ingredient is botulinum toxin. And there is another brands in the world that are also very good, but the one that have more studies, that have more in the market, that have more usage in the world right now is Botox. So I want to show you how it looks normally a box of Botox. One thing also that is important to understand, for example, first it have this kind of stickers in the box. I don't know if you can see it. That means that these stickers are very important to see it because that means that is the original bottle. Normally the box, it had to be open on a side. It have this light label to open it on a side, and we can find some instructions inside. And the most important thing about the product is the bottle. The bottle is like this. You know, you can see it have the brand. Normally each bottle have 100 units, and we are going to know what it's that about the units. As you can see, the bottle looks like it's empty. There is no liquid inside the bottle. The bottle have some white ring in the edge of the bottle that is like a powder. That is the active ingredient. That is the botulinum toxin. So that's why we need to add some regular saline injectable solution to make a dilution of that powder, and so we can apply it. Also, it is important that the bottle, when it's new, it have this plastic cap that I have to take it out. Okay, so it's how when I can inject the saline solution inside the bottle. Normally, I use 1 milliliter of saline sterile solution for one bottle. Okay, so we are going to have 1 milliliter with 100 units. For cosmetic reasons, we can use 1 or 2 or a little more dilution, but normally it's between 1 or 2 milliliters of what we use to make the dilution for cosmetic reasons. Talking about, for example, treating the forehead, frown lines, the crossfit lines, for bruxism, for barcode lines, for the neck bands, etc. So I take out. Of course, it's a new needle with 1 ml, 1 milliliter of saline solution that I put inside the bottle. It is important, for example, also to put the needle against the wall of the bottle to avoid having a big turbulence inside the bottle and create bubbles that can affect the product. And it's also important to inject the liquid very slow. In fact, I'm not pushing the plunge. Even the bottle is taking the liquid by itself because it's like a vacuum effect inside, that it's taking by itself the liquid. That means that the bottle is new, that everything is okay with the bottle. And if that doesn't happen, if I don't feel that the bottle is like taking the liquid by itself, like a vacuum effect, I have to call the laboratory to tell them that something is wrong with the batch. So they have to check it, but that never happened to me, to be honest, in almost 10 years and thousands of bottles that I already used. Then after that, we just make some turns to the bottle to mix the powder and the liquid. So now we are going to have there 100 units with one bottle. No, in 1 milliliter we have 100 units. It's just very important to see that now we have the liquid inside that is clear. There is no any white powder. It's all already mixed. And well, it depends on every area how many units we are going to use. When we talk about units, it means that each line of the syringe, it's 1 unit when I use that dilution. 1 ml for one bottle, so each line of the syringe is 1 unit. If I use, for example, 2 mLs for one bottle, I'm going to have 100 units in 2 milliliters. So that means that every 2 lines of the syringe will be 1 unit. Okay, so every area it's different. For example, from the frown area, I can use between 15 to 25 to 30 units. For the forehead, between 10 to 20. For crossfit area, between I don't know, 6 to 12 per side. It depends on every person, on the strength of the muscle, of if it's a big area, if it's a big muscle, if it's a strong muscle, if it's a man or a woman. Even depends on the result that you want. So that is important to have a correct training. It's important, at least in Mexico, to be applied just by doctors with a good knowledge of the medicine, of a good knowledge about the anatomy, the muscles, the vessels, the nerves, because as I always said, it's not that hard to learn how to inject it. The problem is that if we have some not good results or some complication, how to fix it. It's something that not all the people knows, and if you don't have a correct training, that can have bad results. So that's why I always recommend to have these kind of treatments just with doctors. Okay, I will continue trying to make more videos also in English, because I have a few in Spanish. Please follow me as Dr. Óscar Regalado at Facebook, YouTube, Instagram, even TikTok. And if you want to know about another treatment like fillers, like threads, like stem cells, like some microneedling or some other treatment for the face, please let me know and I will try to make a new video. Please subscribe and give me your like. Thank you. Have a great day.